Okay, good morning, Carbon County. Thank you for joining us for this month's Ortho-Minute. This morning we have Bob Keel, and we also have Missy Herrera, who is an MA in the Orthopedic Clinic, as well as a radiology tech. So with that, Bob and Missy are going to teach us a little bit about some of the new cast technology that we do have available. And Missy has been generous enough to act as a patient this morning so that Bob can demonstrate the application of this new cast technique. And with that, Bob, I'll go ahead and turn it over to you.
So first of all, I'd like to just do a little review of what type of cast materials have been used in the past. I think everybody has seen on TV or heard of the horror stories of the plaster that gets all messy, and that has kind of gone by the wayside, and now we have the fiberglass casting that is most prominent now. The fiberglass casting, you have to put on stuff before you put the cast on. You put on cotton padding, you put on a little sleeve, and then you put on the actual fiberglass. And so there's a lot of process to that. It can get messy. Those casts are known for being stinky, getting wet, and just being generally uncomfortable. And so a company called Ortho-Minute has come out with a product that is a waterproof cast material that can be applied and is a lot more comfortable. So that's what we're going to introduce today. And I've got one here. It's in essence has 3 layers. It has padding on the back side, then it has the rigid plastic that is soft and pliable before you apply it, and then it has an outer coating on the outside that keeps it clean and dry. And so when somebody has a fracture, we can use this type of casting material for something that isn't really severe, something that doesn't involve multiple bones or is displaced. We can use this type of fracture or this type of cast material. So first, what you have to do is you take a measuring tape, and then you measure the patient's palm, wrist, and forearm. And once you get those measurements, you literally just go find the material that fits. And it looks like this. It has a zipper on both sides, and it's really easy to apply. So we're going to show that right now. You put a little padding on here to support the thumb, and then you just take the cast material, almost like a little glove, and you zip it up. Without getting the patient's skin caught in the zipper. There we go. So that's how you do it, and then after it's zipped up, the patient can still move their wrist and everything, and so you want to get it into the position that you need it in. And then you use a blue light to cure the material, and so we have these 2 lights that we use, and I'll just demonstrate that now. And after about 30 seconds of this blue light, the material gets nice and firm and rigid, and allows you to have a immobilization of the fracture. And so let's just go ahead and cure this. Some of the questions I get when I place this cast are, obviously, can we go swimming with this? And the easy answer is absolutely. Go swimming, have fun. The long answer is, just like anything, if you go swim in like a really sandy river or lake, you can get sand underneath the cast, and that can cause problems. So we typically recommend that you only swim in like a swimming pool or a controlled environment so you don't get stuff underneath it. Showering is absolutely appropriate and can make this really nice and easy. And then washing your hands as well. So now, after I expose the light, I can feel how rigid it is, and there's still a couple spots around the wrist that I need to expose some more light to. Patients tell me that it takes about 20 minutes after the cast is exposed to wet, like in a shower, until it gets dried. And I can tell you that with our experience in using this over the last couple of months, there really isn't any problem with the smell that is common with the older type of cast. The disgusting, almost wet, moldy smell that you can get, and so that's really nice. Other questions I get is, what if you don't have a size that's perfectly fit for me? And so as you can see, when we placed this, it was a little tight on Missy's arm, and there is flex and there is some give to the material. And so typically we can find a size that fits for everybody. Occasionally there is a time where you're just right in between, and when that's the case, we use the older fiberglass material. And so another advantage to this is after you leave here, so now Missy's wrist is nice and firm, she can't really move it. She still has use of her fingers, and that's it. You're done, you get to go home, and we typically like to have our patients come back after we put a cast on a week later, do an x-ray and see if the fracture is stable. And this material, you can x-ray through it and you can see the fracture just fine, so you don't really have to do anything to do that x-ray after the fact. And a lot of people are nervous about the removal of the cast. One of the interesting things about this is because of the zipper, most of the time we can just unzip it and pull the cast off. So I'll show you this process. And then you can just open that up and take the cast off. And so this isn't 100% cured already. There's a little more flex than normal, and so that came off fairly easy. Most of the time in clinic, I open it up, you hear a crack or two, and then the patient can pull their arm right on out. So as you can see now, this is pretty rigid. There's no give to it, and it's a really good option for people that don't want to be stuck in one of the older stinky casts. So I'd like to thank you for participating in this week's Ortho-Minute, and we look forward to having you on next time.
Okay, great. Thank you. If you guys have any questions, feel free to go ahead and post those to this Facebook feed, and we will make sure to send those to Bob to have him answer those. One thing, Bob, I would like to ask is, can this be applied to any break or fracture? What about things like fingers or toes?
So fingers and toes, this company, because this product is really new, is continually coming out with newer ways we can use this. Right now, here at the Memorial Hospital of Carbon County, we do not have stuff for fingers or toes, but we do, the main stuff that we have is for wrists, elbows, ankles, leg fractures, stuff like that. And it's not perfect for every type of fracture. Again, if we have a really unstable fracture, we probably want to use the fiberglass material because it's a lot more controllable, and we really want to make sure we're doing what's best for the patient. And most of the time that means they can have this convenient cast material as well. Sometimes we opt to use the other stuff because we feel like it's safer for our patients.
Okay, great. Thank you. All right, thank you guys for tuning in, and we look forward to seeing you for December's Ortho Minute.